Good morning, everybody. Good morning, thank you. Maybe you're out of breath from climbing all those stairs, huh? Thanks for coming to visit us up here on the third floor. Today we're going to talk about staying well at UChicago and how you can help your sons and daughters stay well. So our presentation is on student health and counseling. To talk a little bit about our mission is to provide the University of Chicago students with excellent, comprehensive, and accessible health care. SHCS seeks to provide these services in ways that are student-centered, that engage and empower our students to maintain their own health and well-being, and that provide excellent service to them. First, I want to talk to you a little bit about our Student Health Advisory Board, known as SHAB to us. SHAB's comprised of leadership, campus partners, and then students reflecting UChicago's population. Our purpose is to work together on issues that concern health, counseling, wellness, and insurance across the campus. Students on SHAB solicit and report to students feedback and serve as ambassadors to the student body to deliver messages back and forth. Last year, students on SHAB decided that they wanted to leave a legacy for new students coming in. And their legacy was to create a video that would show students how they could use health promotion and wellness. So I'd like to share this video with you now. Please keep in mind the students in the video are here at University of Chicago still, and the script was completely written by the students.
During your time at UChicago, whether you are a college or graduate student, it is important to take a holistic approach to taking care of yourself.
You don't have to do it alone. Student Health and Counseling Services offers the resources and services to help.
Let's explore some of those now. Student Health Services is where you would go for care when you're sick or injured, but they have so many other services.
Yeah, like gynecological services.
And we provide Pap test, sexually transmitted infection screening, HPV vaccinations, and contraceptive consultations. And we provide routine physical exams, PrEP therapy, travel immunizations, sports medicine care, and we even provide crutches.
I didn't know you offered so many services. That's impressive.
There's so much more to explore at Student Health Service, but first we need to head over to the other units of SHCS. Student Counseling Services is where you would go for mental health care, like therapy, support groups, and more. Your visits here are confidential.
What does confidential mean?
That means that apart from authorized student health staff, no one has access to your counseling files. They won't go on your academic record, and no one even needs to know that you visited SCS without your permission.
We also have counselors who are specially trained to help students with alcohol, substance misuse, eating disorders, LGBTQ concerns, couples counseling, and more.
We have helpful programs like the Academic Skills Assessment Program and Let's Talk, which offers informal drop-in consultations with a counselor at various locations on campus.
Also, you don't have to be in crisis to make an appointment with SCS. Students are encouraged to visit for any issue they may be facing, whether it seems big or small.
Very cool. I wish we could stay, but there are still more resources to see. So, where are we going now?
We're going to the Student Health Insurance Office.
What insurance? All that paperwork? Oh no, why would you bring me here?
I know insurance can seem overwhelming, but it's really not that bad. And the student insurance staff are here to help.
We are the on-campus representatives of United Healthcare Student Resources, here to offer you guidance and assistance with your USHIP coverage.
Really? Wow, I didn't know there was someone on campus to help. I should really start reading the emails your office sends.
Rookie mistake. Here's some advice. Always read the emails that student insurance sends and pay attention to the deadlines. If you need help deciphering things, call one of the coordinators.
Please do. We're always glad to help.
Okay, yeah, I can do that.
I'm so glad you finally understand the importance of insurance, but there are so many more resources to see, so we have to go now. Bye, and thank you so much for your time.
Hey, I know where we are. This is the Health Promotion and Wellness Office. They do public health initiatives on campus.
In my house, the well czars and peer health advocates reduce the risk of sexually transmitted disease and unwanted pregnancy.
How?
They provide safer sex resources, present sexual health workshops, and train the Wellsars on where to refer their classmates if they need help.
That's a great example. We actually reduce risks on campus by training the UChicago community in how to respond to signs of mental illness, and then we provide alcohol education on how to plan safe events on campus.
But how do you promote balance?
Well, we promote balance by focusing on the 7 key facets of wellness, and then we link students to the resources, the events, and the programs on campus that actually help develop and maintain those facets.
Yeah, I build my physical wellness by attending weekly yoga, my emotional wellness by practicing mindfulness, my social wellness at Uncommon Nights, and I explore multiple facets of wellness by attending Wellapalooza.
I'm impressed. How do you find time for all of that?
Well, it's not easy, but I make time because I understand how important it is to take care of yourself. And with all the student health and counseling resources available on campus, it's not hard to find help.
You're right. Why doesn't everyone know this?
I don't know. Let's tell them now.
Hey, UChicago. Whether you spend all day in a lab or in the library poring over texts or in the field collecting data, we want you to be successful.
Success starts with taking care of yourself. Student Health and Counseling Services is here to support and guide you through this process.
So now I'd like to talk a little bit about something that's called the student life fee. All registered students pay the student life fee. All registered students have access to the services that are listed above. We have services in counseling, health, and promotion that are covered under the student life fee. So what that means is that students can have visits at student counseling and student health without an additional charge or without being billed to the insurance. You also may be aware that students are required to have health insurance. So this slide really goes through what is covered under the student life fee versus what would be billed to the student insurance. So the left-hand column talks about what is offered at student health services that students could come in and not have any bill and not pay any additional fees. This would include things like routine physicals, acute chronic care, cervical and pap smears, sexually transmitted infection testing, rapid strep, all flu and required vaccinations, allergy injections, if that's already been established, travel health consultations, contraceptive, sports medicine, and movement specialist. We also offer many of the basic labs to the students without additional charge. At student counseling, there's diagnostic assessments, crisis intervention, short-term psychotherapy that includes individuals and couples, support groups, and workshops. The column then on the left identifies things that would be billed to insurance and would have an additional cost. Those things could include medications, consultations, some ER immunizations, some hospitalizations, and additional lab tests, along with additional long-term therapy. So this is how to access our service. The health center, the counseling center, and health promotion and wellness are located around the campus, and here are our hours. We have insurance coordinators here Monday through Friday to help students answer questions about their insurance and go through their bills. And we also have a pharmacy that's located on the corner of 57th and Maryland that we call DCAM, where the students can simply walk over and have their prescriptions filled. And here is a map highlighting our different services. As you can see in the yellow, health promotion and wellness is on the south side of campus across the Midway. The Student Health Center is right north of the Midway, located at the corner of 59th and Maryland. This is in the medical part of the campus. You can see in red is the DCAM pharmacy, so simply walk across the street and get their prescriptions filled. And then down there in the green is the counseling service, which is located on the far north side of the campus on Woodlawn and 56th Street. The counseling service is in a building called Alumni House. So if you have a chance to walk over there, you'll see the sign outside that says Alumni House. So just so you're familiar with the utilization of our services, student counseling service last year had 12,000 visits, handled 900 daytime emergencies, and 182 evening and weekend emergencies. Student Health Center actually had 13,473 visits, along with an additional 10,000 visits that included things like immunizations and flu shots, for a total amount of 23,000 visits. So I'll talk to you now a little bit about student health service. We have a vast and diverse staff at Student Health that includes physicians, advanced practice nurses, registered and licensed practical nurses, a medical assistant, and a fabulous phlebotomist who can draw blood without causing virtually any pain, and administrative staff. We are there Monday through Saturday. Our hours on Monday through Thursday are 8 to 6. We're there 8 to 5 on Friday, and Saturday from 9 to 1. We offer a few different types of appointments, one of which is same day or urgent care. If a student decides that they need to be seen, they will call or walk into the clinic. When they do that, they will talk to a registered nurse who will walk through what their symptoms are, what they're experiencing, and will make a determination of whether they need to be seen today, tomorrow, or next week, and we'll get them an appointment. Things that we see same day can include things like injuries, fevers, rashes, conditions that aren't getting any better, and those in pain. We also offer primary care and ongoing appointments. These would be for things such as physicals and travel visits, chronic condition management, women care and contraceptive, sexually transmitted infection screening, PrEP therapy. If you haven't heard of PrEP therapy, we're very happy to be able to offer this. This is a program that offers medication to students who may be at high risk for contracting HIV. This medication would prevent them from becoming infected with HIV. We also have a comprehensive vaccination program. We do allergy injections, and we also have just added hereditary cancer screening. So if a student identifies themselves as a person who is at high risk for developing a hereditary cancer, we do screening for them at no charge. And if they come up with as one of the cancer markers in their genes, we will establish a program for them for their entire life to be able to make sure that they stay ahead of their health. We have a 24-hour nurse advice line, so at any time a student can call the Student Health Center and be connected to a nurse who will walk through their symptoms and give them advice. We also have an emergency room here on campus, right on the medical side of the campus, that is available 24 hours a day. So just to highlight the flu event, and I ask that you encourage your students to get vaccinated against the flu. We have an extremely comprehensive flu program. We start giving flu injections on September 30th and continue all the way through November. We are out and about with our flu. Our flu program is quite mobile, so you'll see that we are in areas that we think that we are going to have students come and get their flu vaccine. Their flu vaccine is absolutely free. And now I'll talk to you a little bit about student counseling. The staff at Student Counseling consists of psychologists and psychiatrists, a social worker, and administrative staff. It is also a training center for postdoc psych trainees, psychology externs, and psychiatric residents. Some of the services that are provided at Student Counseling: they have mental health counseling for individuals, couples, and groups. They have psychiatric treatment along with psychotherapy, crisis intervention, and 24-hour, 365 days a year emergency on-call service. They do alcohol and drug abuse assessments and intervention. We have a multidisciplinary eating concern team that is both health and counseling working together. We have an academic skills assessment and support, which is called ASAP, and that's a program where if students are having difficulty with time management and organizing their priorities, they can come in and talk to someone about their study skills. We have satellite walk-in services called Let's Talk. That's a really casual event where students can simply just drop in. They don't have to give their name. They can sit down and talk about anything that's on their mind. We do consultation to faculty and staff, and something that we're very proud of is that we can get them in to see a counselor if needed with no wait. So how do you schedule an appointment at Student Counseling and Health? These are the 2 phone numbers that we encourage students to call. One thing that we are very proud of is that we are very concerned with confidentiality, and so we keep the students' visits very confidential, which means if a student is 18 or over, we will not be allowed to talk to parents about the type of care that we give unless they sign a consent. So the consents are available both at counseling and at health. So once a student is seen at either one, if they wish to give permission to one of the providers to talk to one of their parents, they can simply sign a form, and we're happy to do that. We do that every single day. Now I'll turn it over to Julie, who's going to talk about health promotion and wellness.
Good morning, everyone.
So my name is Julie Edwards. I'm the Director of Health Promotion and Wellness, and I'm also responsible for the Student Health Insurance Plan here at the university. So first, talking about health promotion and wellness, I always say that our team is a small but mighty team. We have 5 full-time staff, but we also have students who work very closely with our department. So my staff consists of health educators, administrative staff, and then we also have an office manager who helps with a lot of the day-to-day happenings within our office. And then we have students who actually volunteer their time as either peer health advocates or WellSARs. The peer health advocates are trained by my staff on various topics so that they can then present to their peers on those topics. So currently we offer information on body image, self-esteem, and sexual health. And we are looking at other alternative topics such as alcohol and other drug education, as well as some health-related topics that they would be able to provide in the future. They also go out and present on student health and counseling services overall, because what we found is that peer education is very important. Students would rather hear from their peers as opposed to us going to speak to them sometimes. So it's great for us to have these student workers who will go out into the houses or go across campus and really present our information. The WellSARs are another opportunity for students to get involved, and they are actually elected within their housing system. So there's typically 1 WellSAR per house, and they're a liaison between our department and their house. So they'll bring in sexual health topics on campus. They'll also bring in resources. They'll also have our peer health advocates come, or sometimes our staff come to talk to their house on a variety of topics that they might be interested in. So the WellSARs are a great resource that I would highly encourage your students to look out for within their housing system. And lastly, we have a graduate student from social services who works in our department as a mental wellness coordinator. And so I'll be talking about some of our programs, but she helps coordinate some of those. So last year we implemented this Facets of Wellness framework. You saw it on the video, but I just wanted to describe it in a bit more detail. And you may be familiar with dimensions of wellness, but basically this framework, we want to visually be able to show students the importance of maintaining balance for overall well-being. And so obviously students are here for academics and they're here for that intellectual side, but we also want them to understand that they have, in order to be holistically well, they have to take care of each of these areas. They have to find balance, because if they're not getting the appropriate amount of sleep, if they're not eating properly, if they're not socially interacting with their peers, then other things will start to slide and they won't feel as well. And so that's why we use this framework to link our services, not just our services, but also across campus, so that students understand the importance of this. So this framework they may see on a lot of our marketing materials within student health and counseling services, but across campus as well. In health promotion and wellness, we do, as mentioned in the video, public health initiatives. And what I mean by public health is that we look to try and have the greatest impact for the largest number of people. So we offer a lot of different events on campus from the preventative side of health and wellness. Large-scale events include something we call Wellapalooza. So that is scheduled for October 5th. It's twice a year, but this quarter it's October 5th, where we have it on the quad. We have about 30 to 40 vendors, meaning campus partners and companies within the Hyde Park area that come and really do interactive demonstrations. They have a lot of resources for students, but it's kind of a one-stop shop where they can really get exposed to a lot of different resources at one time. And our Pet Love program, we bring certified therapy dogs on campus, and so that's once a quarter, and it's very well attended. Students love animals. And so within the 2-hour time frame that the dogs are on campus, we have between 500 and 1,000 students that come through. And so it's just a great way for them to have a little stress relieving activity before they head back to classes. Now for our programs and trainings, we actually offer mindfulness meditation. And that is a 4-week course that we offer 4 times per quarter. And the students can just engage. We teach them belly breathing, we teach them deep breathing exercises, a lot of tools that they can at least take with them so that if they're feeling stressed or anxious, that hopefully it would help them in the future. Our Refresh Sleep program is something that we offer. It's completely online, students would self-select to participate in this program. They would receive an email from our office once a week for 7 weeks, and it's information on why sleep is important, how they can incorporate better sleep into their daily life, and how they can set up their dorm room and their space so that it's better for sleep. And so that information has been very well received by both graduate and undergraduate students. And lastly, we offer mental health first aid. It's something that I was very proud to bring to campus last year. We only trained last year staff and faculty, but this year we are also offering 2 pilots to students. And the training is very similar to CPR, where we will be training individuals on how to identify the signs and symptoms of mental health issues. How can you have a conversation with someone who might be experiencing those symptoms? And then how do you refer them to the appropriate resources on campus? And so it's something, it's a significant time because it's an 8-hour training, but we've seen fantastic results and people feel much more prepared if something like that would happen in the future. And then we also offer general and customized workshops. So as I mentioned, our peer health advocates do body image in our body project, and In Touch is our sexual health workshops. But then we also offer a variety around sleep, around stress, and time management. So those all are offered on campus. We try to make it very easily accessible for students. So that's some information on health promotion and wellness, but now I'll switch hats and talk about student insurance. So as I hope all of you know from emails that maybe you've received from our office, health insurance is mandatory for all registered students. And as Jen had mentioned, the student life fee covers health, counseling, and health promotion and wellness, but there are certain things that health insurance would have to pick up if there was additional testing needed or outside physicians that a student would need to see. You can fulfill the requirement of insurance in one of 2 ways. Your student, if they're already on an existing plan that you have, and it meets our comparable coverage requirements, they can waive the USHIP so that they wouldn't have to pay the premiums. But if you don't have them on a plan that meets the requirements, or they need to access insurance, you need to get them on an insurance plan, they can actually enroll in the USHIP plan. And they would do that on our website. We have an easy button that it says enroll or waive here. So they would just click on that so that they could satisfy that requirement in either of those ways. The coverage for this plan is effective from September 1st till August 31st. And just to go into a little more detail, because I like to make sure I stress this to as many people as we talk to, all full-time students are automatically enrolled in USHIP every academic year. So if you waive this year, that doesn't mean you're waived for the entire time your student is here. Every academic year, they will need to do so, and the same with confirming. You want to make sure that you stress this with your students because the deadline to waive or enroll in the plan is September 30th. And if they do not waive by that time frame, they will be charged the premium and it will go on their bursar bill. So I just want to make sure that everyone is aware of that piece. So the other piece is that you can go directly to the website uship.uchicago.edu. That takes you to the direct site where they can enroll or waive, or they can access the insurance site on our overall pages and they'll get the link there as well. So there's a couple of ways to access. And I see there's one question, but I will take questions at the end if that's okay. Perfect. Just to go over the premiums for the plan. So for student, the annual premium for the USHIP plan is $3,615, and it's billed in 3 installments. So if your student is obviously enrolled in autumn quarter, there would be a bill of $1,205 in autumn, winter, and spring quarter that they would see on their bursar bill. Now, I do want to stress that our plan through the USHIP plan is a platinum level plan. So it's a very benefit-rich plan that our students can get access all over the world. So if they're studying abroad, they would have access. So it does cover them all over. Some of the benefits for the USHIP plan, the deductible for in-network providers, it's $500. Out-of-network, it's $1,000. The annual out-of-pocket maximum for in-network is $1,500 versus out-of-network $2,500. Co-insurance for in-network, it's 10%, meaning that the plan picks up 90% after your deductible has been met. It's 30% out-of-network. And then for prescriptions, if your students need medications and they're on the USHIP plan, it's in a tiered system. So it would depend on the medication, but there's 3 tiers. They would either pay $10, $25, or $40 for copay. And then if they're referred out, so as I mentioned, the student life fee covers the health clinic, and the health clinic serves as their primary care when they're on the USHIP plan. So students who would need care could go to the clinic first. They would need to see a physician, and if they would need to be referred out, the physician would do so, and then the USHIP plan would pick up that coverage. So if they don't receive the referral, they can still go to, say, a Minute Clinic, or they can go to a physician outside, but there is a $50 penalty fee if they don't see the health center first. So just so you're aware, this is only if they're on the USHIP plan. And the copay, if they would go after they receive their referral out, it would be $20 to see a doctor as a copay. And the same works for counseling center. So if they needed psychotherapy services or long-term care, they would go to our counseling center first, and they could be referred out. We have agreements with a lot of therapists within the Hyde Park area. And so once they got that referral, they would only pay a $10 per visit charge. And so it's as I mentioned, it's a really benefit-rich plan that I like to call everyone's attention to and make sure that you're aware of that. I don't think I cover insurance terminology with students, but if you have questions about it, I'm happy to answer them. But the reason we do that is because sometimes the premium is a sticker shock to people looking at that. And so we want to make sure that everyone is aware you have to look at the deductible, your out-of-pocket maximum, as well as your coinsurance when you're factoring in all of those costs that you would have out of pocket. And so this just gives you an example or a comparison of the USHIP plan versus 2 plans that are on the exchanges, the Land of Lincoln and the ISOCare plan. So you'll notice how they're all designated. USHIP's premium is higher than the others, but the benefits are better as far as the coinsurance and the annual out-of-pocket max. And this is what it looks like if your student had a $5,000 medical bill. So as you'll notice, $5,000 is the bill, same bill across the top, but with the USHIP plan, you would come out of pocket $950 versus just over $2,500 on the Land of Lincoln plan and $1,400 for the ISOCare plan. So that's why we strongly encourage parents and students to factor in all of these areas, the premium, the deductible, your coinsurance, and your out-of-pocket maximums, so that you understand all the costs that might be incurred if there was a medical bill that your student faced. We also offer 2 different elective options. We have dental coverage as well as vision coverage. So for dental, we have 3 different options that are available for students through Cigna, Delta Dental, and United Healthcare. And so you'll see the comparisons. We have this information also on our website, but this is elective, so it's not something that would be billed through the university. If the student chooses to enroll in dental, they would go on our website, they would be linked to one of those insurance companies to the UChicago page, and they would enroll directly with that company, and they would pay that premium to that company. So that's how dental works, as well as vision. Vision is also elective. We offer 2 plans for vision through iMed, which is Delta Dental, and through United Healthcare. And the same thing would happen. They would enroll directly through that company. We have a UChicago specific page, and then they would enroll that way and pay the premiums directly to the company. So the medical plan you'll see on your Bursar bill if you enroll in that plan, but the others you would pay directly, and the students would receive confirmation via email. So just about accessing insurance assistance on campus, we are very fortunate to have on-campus student insurance reps through United Healthcare. Janice Thomas is to my far left, and she is one. She's in our office and can answer questions that your student would have. Rochelle Porter is also with United Healthcare, and they are always readily available for students if they have questions on their bills, if they have questions on enrolling, how do they waive, what information do they need, they can help in that way. And then I serve as the university contact so that if students have questions on our policy or just things that are happening, they can also talk to me. We're all located in the same building at the Woodlawn Social Services Center, so we try to make it very easy for students to access us. And just to sum up healthcare in general at UChicago, as we mentioned, the student life fee covers health, counseling, and health promotion and wellness, but there are some things that they would have to have insurance for, and that's why it's a mandatory requirement. Any additional services, tests, and specialists would be covered through either your USHIP plan or through your own insurance that they're on. And then the coverage is effective from September 1st through August 31st. And just as I mentioned, in reviewing different alternative coverages, making sure that you keep in mind all of the impact that would be as far as cost, premiums, deductibles, co-insurance, and out-of-pocket maximums. And then making sure if you are waiving coverage that your plan does meet our comparable coverage requirements. Those are available on our website. If they don't, we do audit the ones who have waived, and we'll go through. So if, for instance, you waived and it didn't meet all of the requirements, then they would either have to enroll in the USHIP plan or find alternative coverage at that time. So our website is wellness.uchicago.edu, and it encompasses all 4 of our areas: health, counseling, health promotion and wellness, and insurance. And now I would love to open it up for questions, if we have questions from the audience. I have one back there. Great question. So the question, if I should probably repeat it for the video, is that if they're automatically enrolled in USHIP, do they have to take an active role at any point? Yes, they should, and the reason I recommend that, they are automatically enrolled, but if they actively enroll on the site, that gives them access to their ID card sooner. So that, because September 30th is the deadline, so your students are here on campus now, so if they went in tomorrow, they won't have their ID card and number to be able to use the insurance, nor would United have their information in their system until that feed goes through on September 30th. So that's why we recommend that students actively enroll in it if they know that they're going to be on that plan. And the second question was, is it quarter by quarter or is it an annual plan? And this is an annual plan from September 1 through August 31st. So that if your plan would pick up in January, for instance, the student needs to be covered from September 1st through August 31st. That's one of the requirements. And so we want to make sure that they're covered while they're here. And so that's the reason behind that. But thank you for those questions. Yes?
So, I don't know if this is different from most of the other. We have Greater United Healthcare
Mm-hmm.
that they just turned 18. So, So I want to see what your example, and I would like to see what's going on in physical therapy and something like that. Can I see his stuff, even though he's over 18, or does he need to check something off to allow us to see his record? And then number 2, is there any difference in terms of what he would do as a non-USHIP person? Say he's sick Sunday morning and he's got high fever,
Mm-hmm.
to go get help and get a prescription.
Sure. No, that's a great question. So the first question was, if her student who just turned 18 had a broken ankle or something, would she have access to see the health history? You would have to fill out that consent form that would be available in the health. Your son or daughter would have to do so that they're giving you consent to access their records. Because as Jen mentioned, we do keep the confidentiality, and when they're over 18, they are considered adults, so they can make that decision, but they can sign off on that consent form in both counseling and health. Did you want to add anything?
So just to add to that, the medical center uses a software called Epic, which enables the students to set up something called MyChart. MyChart is something that they can go into and view their records, view any information that the physician had put in for them, and also their prescriptions. We highly encourage and give the students all the information when they come see us in the health center on how to sign up to get that MyChart. Now, if they share their password with you as a parent, then obviously you'd have access to their records as well. This also provides a portal for students to talk directly with their healthcare providers. So they can email back and forth to their healthcare providers asking questions and getting clarification.
Great, thank you. And your second question, I'm sorry, could you repeat the second?
Sure. So, if my child has United Healthcare.
Oh, yes.
Mm-hmm. The school and you're sick Sunday morning, is it the exact same process?
Right. So if the student was sick and they have an alternative coverage, so they're on their parents' plan, and they were sick on a Sunday morning, how would they access care? So the clinic, God bless you, the clinic would be closed on Sunday, so they could, all students, regardless of their insurance, can cover or call the 24-hour nurse advice line. So that's first and foremost. They can contact that line and then tell their symptoms so that the nurse on the other line can advise them if this is something urgent that they should really go to an urgent clinic, or if it's something that they might be able to wait to go to the health center on a Monday when class is open or when they're open again. So that's something to keep in mind. But the health counseling and health promotion and wellness, it's only based on your student life fee. So they don't need insurance to access our areas. They just would need the insurance for alternative care outside of our area or additional testing. And so the insurance, whatever your insurance would be if they're on that plan, then that would kick in. If you have different copays or different requirements through your plan, then it would be the same if they would go to an outside place. Yes, no problem.
It's probably advisable also to go over your insurance and where you would want your student to go if it was after hours. So to go on your insurance website and see where is the local minute clinic that is covered or so on, because there are several options in this area that they could go to, the emergency room being one of them. But it also is really an emergency room, so it's designed for true emergencies. And so there's these other urgent care centers around the area that if we were closed that they would want to identify.
I know if they're on the UChip plan, they'll have access to their ID card electronically, but they can also request a hard copy be mailed to them, so they can request it through United Healthcare. I have two college students, and so I actually requested through my insurance company additional cards so that they each have their own cards so that if anything happened, they have easy access. So if they're on the UChip plan, it's very easy. They can pull it up on their phone or they can request a hard copy. But if they're on another plan, I would highly encourage you to ask for another card that you can then give to your child. Yes? Rochelle, would you like to answer that?
I'm sorry, I didn't. Your question again?
And repeat it.
Let's say that a physician at the student health center recommends something, let's say an MRI or a CT. Is there like a special arrangement that United Healthcare will automatically do this, or is there a certain record of these being denied because they don't believe it's medically required, and is that a common or a rare occurrence?
If the student council or the student health center refer your student out for MRI, it's normally because there is a medical condition, so that would automatically be covered under the plan. Yes, yes, it's covered. Yes.
I will also say that our physicians and our providers work very hard to make sure that we keep costs to a minimum. They understand the plight of students and really try to do as much as we can in the student care center before we refer out to a specialist who, no matter what, is going to incur some charges. I'll also take this opportunity to say that the Student Health Center has a very nice working relationship with an amazing medical center right here on our campus, and we oftentimes we'll call over to certain specialists and have them come in the clinic, and they will see students with no additional charges either. So we're very, very lucky to have that nice relationship with a great medical center right here on our campus.
And if your student is on another insurance plan, what I always encourage students to do is contact the insurance company if they need to have service done or something, just so that they know what they can at least have an idea of what those costs could potentially be.
And we have coordinators in the clinic who also help in this. So when a student has a referral and they go to check out with one of our coordinators will take a look and say, okay, this is going to be a cost and so on. So we prepare them to some extent.
So I have a question all the way in the back in the white shirt. Yes. You. Yes. So I'll repeat the question, then I'll have Jen answer. The question is, if your student has food allergies or if there's an emergency, do we have ambulance services available, and what is the process? Would they just dial 911, or what would the process be?
So the University of Chicago Police Department is on campus here. They have an emergency line that is distributed to the students, and we have the students actually put it right in their phone. But calling 911 is always the best option. And yes, the ambulances will come, and they will most likely take them to the University of Chicago Medical Center, which is right here on our campus. I say most likely because there are times when the emergency room is at capacity and can take no more patients, and so they may be deferred to another local emergency room, but they're going to go to wherever they're wherever they're instructed.
One note I'd like to make about the ambulance services is that if your students are on USHIP, there are private ambulance companies and medical center ambulance companies, and what we've done is we've coordinated with United to offer the same out-of-pocket for ambulance services. So it's $500, which is all in-network, as opposed to having different ones for out-of-network, because you can't tell which one you would get in the event of an emergency. So we were very pleased to do that this plan year. Yes.
On the waiver form online, I got on there and tried to help my daughter fill it in. The top half was very self-explanatory. The bottom half, I got into a couple of questions where I'm going, I don't know. So what do I do with that? We're on a family plan, don't really want to, which is very adequate, and don't really
Sure.
need the other insurance. So how do I address the questions that I don't know the answers to?
So the question is that she has alternative coverage already, and she was going through the waiver form online and didn't know the answer to some of the questions that it asks. What I would recommend, we have a comparable coverage checklist that's on our website. I would recommend that you take a look at that and contact your insurance company and just go through that list so that you'll have the appropriate answers for that, so you can answer them. And it has to be for an individual or a family. It has to be a certain level of out-of-pocket maximum. It has to cover them while they're in the city of Chicago, because we know that students might need assistance here, so we want to make sure they have coverage. So there's certain things like that that are in those comparable coverage requirements. I'd recommend you take that checklist, and then if you're able to contact your insurance company and just get the answers to that, then you can easily fill it out. That's why we tried to make the checklist. The checklist is exactly as the questions are in the waiver form online.
Actually, we have a copy of the checklist if you want to take a copy.
Yeah. Yes.
The absence of the dental and the site insurance, is there no coverage? The student has a little problem with the tooth or something, or should one go in for these optional insurances too?
Great.
Because the fact that they are kept optional, or if you can go right on how many people in terms of statistics go in for the option.
So the question is, if you do not opt into the dental or the vision, would your student, if they had some issue with their tooth, would they have coverage if they were just on the medical plan? And I'll ask Rochelle to answer that question.
The medical plan would only cover your student's dental if it's related to an injury to a sound natural tooth. Other than that, no, there would not be any dental coverage for any routine medical, or routine dental coverage, or if your student has just a toothache, there would not be any coverage for that under the medical plan. Only if it's related to an injury.
Yes.
So if we opt out for fall coverage because we have family coverage, is there an option to opt in if she decides in winter or spring, or is there an option, is it like the decision for enrollment in plan is either fall or next fall?
So the question was, if their student opted out of the plan right now, would there be a potential option to opt in January or in spring? And there would not be, unless you met a mid-year criteria. If she was on a plan that you guys lost coverage, or if she got married and was on a plan through her spouse, there are different options, the mid-year criteria. But if you didn't meet mid-year criteria, she would not be able to enroll in the plan. She would have to stay on what you have. Or, if they enroll in the USHIP, it would be for the entire year. You had a question?
Yeah. Related to, you signed a waiver
Oh, great question. So the question is, they completed a waiver form and they were asking when the audit would be completed on those who have waived. Typically, it's done after the deadline, so normally at some point in autumn quarter, and then we would just email your student because it's all based on their student ID. They would get an email if they didn't meet those requirements. Yes, if they did not meet the requirement, they can enroll in USHIP. That would be the one way that they could if their current plan doesn't meet the requirements. Yes?
Is there an easy way to get a list of in-network providers for the health insurance and the dental coverage? Providers were reasonably nearby.
Sure. So the question is there a way to get a list of in-network providers? And yes, they are available on the United Healthcare website and also on the Dental and Vision. You can look at their providers before enrolling in those. They have a list that's on the UChicago specific site. So you can take a look at those to see what you would want to use. Yes?
Is there a way for a parent to fill in and fill out the waiver form, or you have to go through your student on the site?
Great question. So the question is there a way for a parent to fill out the waiver form? And so that's up to your student if they want to share their CNET ID and password with you. I know that we have had students do that. And so if that's the case, you can get in there and enroll or waive them, but other students do it on their own. So it's completely up to your student because they have to log in with their specific CNET ID here at the university as well as their password. Mm-hmm. Any other questions? Yes? Is there a list of providers? Oh, HMO. So the question is there a list of HMO providers available at the university? So are you asking about your specific plan? Or, okay, so a plan that you have, I would recommend you contact your insurance company because they should be able to provide a list of providers that are within this area. You can normally give them a zip code and they can show you the providers that are within that zip code area. Mm-hmm. I'm sorry? So it would be, yes, if they're staying on your plan, they would be available. There might be some that are in the university, but it depends on the plan. So I would really recommend that you contact your insurance company to see what providers are either in the medical center or available in the area. But they can go, as we mentioned, the student life fee. So if their students are on your plan, the student life fee, they're able to go to the health clinic if they need routine care or even urgent care. They can go to the clinic and that would be no cost to the insurance. But if they needed further follow-up, you'd have to see with your insurance company what HMO providers are available. Okay?
That's right. No matter what insurance they have, come to the health clinic. We'll provide care. And then if we need to refer out, we'll help with that referral.
Yes.
So if a student on the parents' plan and do you have the list of the physician name on your student health center so we know that it's in our parents' plan network?
You don't have to worry. So she's asking, do we have a list of physicians so you can check your insurance to see if our physicians would be covered? You don't have to worry about that in student health care. At the Student Health Care Center, we are providing it at no charge. We do not bill your insurance. So if your student wakes up and has a sore throat, they simply come to the medical center. We will see them and do a culture on their throat, give them a prescription, and send them on their way. The only cost to you would be filling that prescription. You don't have to worry about our physicians. They're covered. Okay.
They're all covered under the student life fee, so that's why it's different. The physicians in the clinic are covered under the student life fee.
Yeah.
Yeah. Oh, sorry.
Where do they fill the prescription? Right across the street. We call it the DCAM Pharmacy. It's located in one of the large buildings, about 57th and Maryland. It's right around 57th and Maryland, so it's within walking distance for them.
Mm-hmm. And there are alternatives if they're studying abroad, if they're out of state or something and they need it, they can go to a Walgreens, a CVS, so it just depends. But that would then obviously be billed the same way it would through whatever insurance plan they're on. There was a question back here. Yes?
I was just wondering, when you pointed on the map to where the student health center is, I couldn't see it. I don't know where it is. Is there a specific access?
Yeah.
So Yes, go ahead.
Go ahead.
No, go ahead.
It's at 59th and Maryland, and there is an entrance there. It's called the Goldblatt Pavilion, and it actually says in the building Comprehensive Cancer Center.
And on your maps, it does not designate the clinic, but it's the large orange building that's on 59th, or I'm sorry, yes, 59th and Maryland. We did circle it in our previous one, so if you want to come up, we'd be happy to do so that you guys can have it circled on your maps, but it's not called out. But when the students walk into that Goldblatt Pavilion entrance, they would turn left and then left again, and the clinic is right there.
There's the security guard right there will point them in the right direction. And I also have cards up here with my information on it with the address.
Yeah.
Okay, so you're welcome to help yourself with that. There was a question in the back.
If the student is under 18, how do you access their medical records?
Great question. So have you signed a consent for them to be treated yet? Yes. So we're covered there. How would you access there? I don't know, but you know what? I will get back to you on that one. That's a good question. Thank you. If you come up and see me afterwards, I'll get your contact info. Thanks for asking.
Any other questions? Well, we'd like to thank all of you today for participating, and we hope you found it informative, and welcome to all of your students and to you as families to the university. Thank you very much.
Yes.
The one thing that